Chronic pain. If you ever felt it, you know it's more than just a sensation. It can shape your days, your energy, and even your identity. But what if I told you that knowing how pain works could be the first step in reclaiming control? Welcome. My name is Jorge Guzman. I'm a neurosurgeon and a pain management specialist, and I want to take you on a journey into the science of pain. What causes it? Why it persists? And how can we approach it both with knowledge and compassion? Whether you're a patient, a caregiver, or a healthcare professional, this video is for you. Together, we'll explore the intricate pathways of chronic pain, uncover differences between neuropathic, inflammatory, and nociplastic pain, and look how specific conditions, from lower back pain to migraines, fit into this complex puzzle. Because understanding pain isn't just about science, it's about hope. And by the end of this video, my goal is that you walk away not just with information, but with the confidence that chronic pain can be managed, treated, and for many, transformed. So let's dig into it. Pain perception is a highly intricate process, mediated by a network of specialized neurons and modulated at multiple levels of the nervous system. To understand chronic pain, we must first examine how pain signals are transmitted and processed. Pain begins at the nociceptors. Sensory neurons that detect potentially harmful stimuli. These nociceptors are classified based on the fibers that transmit their signals. Fast A delta fibers, myelinated fibers responsible for transmitting sharp, well-localized pain signals at high velocity. These are the first pain signals that alert the body to acute injuries. Slow C fibers, unmyelinated small diameter fibers that conduct pain signals at a slower rate. These signals are associated with dull, burning, or aching pain, often characteristic of chronic pain conditions. Once activated, nociceptors relay signals to the dorsal horn of the spinal cord, where pain processing begins. Here, neurons in the spinal cord either amplify or dampen the signals before they are transmitted to the brain. The spinal cord utilizes complex inhibitory and excitatory mechanisms to modulate pain intensity. From the spinal cord, pain ascends via spinothalamic tract and the spinoarticular tract to the brain, where perception occurs. The thalamus acts as a relay station, distributing pain signals to high-order structures, including the prefrontal cortex, which governs cognitive and emotional responses to pain, influencing pain perception based on personal experience and context. The amygdala, a key player in the emotional processing of pain, often linked to fear and anxiety responses in chronic pain sufferers. The nucleus accumbens, involved in the reward system and pain modulation, contributing to the persistence of pain in chronic conditions. Pain modulation is further regulated by descending pathways originating in the brainstem, including the periaqueductal gray, PAG, and rostroventral medulla, RVM. These pathways exert inhibitory control over pain signals, modulating their intensity and potentially altering the chronic pain experience. Dysregulation of this system is a hallmark of chronic pain syndromes, leading to persistent pain despite the absence of ongoing injury. Understanding these mechanisms allows us to see that chronic pain is not simply a prolonged acute pain state, but a fundamentally altered sensory processing condition. This interplay between peripheral nociception, spinal modulation, and central processing creates a unique and often debilitating experience for each individual. Pain is a deeply personal experience, and yet it follows specific physiological patterns that help us classify it. Each of you in this audience may relate to one or more of these categories, as chronic pain manifests in different ways. Let's break it down into three key types. Neuropathic pain. This arises from nerve damage or dysfunction. It is often described as burning, tingling, electric shocks, or stabbing pain. The nervous system misinterprets normal stimuli as pain and sometimes even generating pain without an apparent trigger. Common conditions include diabetic neuropathy, postherpetic neuralgia, trigeminal neuralgia, and sciatica. Inflammatory pain. This occurs due to persistent immune activation, often leading to swelling, stiffness, and ongoing discomfort. The body's defense system remains in an overactive state, causing prolonged pain even after the initial injury or illness subsides. Examples of this include rheumatoid arthritis, inflammatory bowel disease, and ankylosing spondylitis. And the third is nociplastic pain. This is a newer category used to describe pain where no clear structural damage or inflammation is found, yet the nervous system remains sensitized. Patients experience persistent pain due to abnormal central processing of pain signals. Conditions like fibromyalgia, chronic migraines, and complex regional pain syndrome, CRPS, fall into this category. Each of these types of pain can overlap, making diagnosis and treatment complex. However, recognizing which category best describes your pain is a critical step towards finding the right management strategies. Lower back pain is one of the most common complaints and often involves complex interactions between spinal structures. Pain in this area can originate from the intervertebral discs, facet joints, or the muscles and ligaments supporting the spine. Discogenic pain, for example, occurs when degeneration or herniation of an intervertebral disc irritates nearby nerve roots, leading to radiating pain that may extend into the legs. Similarly, facet joint dysfunction, where the small joints at each vertebral segment become inflamed or degenerated, can produce deep, aching pain. The hallmark of lower back pain is its variability, ranging from sharp, localized discomfort to diffuse, chronic ache that affects mobility and quality of life. Patients often describe difficulty in standing or sitting for prolonged periods, and these symptoms can significantly impact daily activities. Joint and headache pain. Joint pain encompassing conditions such as arthritis and autoimmune-related arthritis present another dimension of chronic pain. In osteoarthritis, the gradual wearing away of cartilage results in bones rubbing against each other, causing pain, stiffness, and reduced range of motion. This type of pain is typically exacerbated by activity and relieved by rest. Conversely, in conditions like rheumatoid arthritis, the immune system erroneously targets the joint lining, resulting in inflammation, swelling, and pain that can be symmetrical and involve multiple joints. These conditions are not the only physically debilitating, but can also have emotional and psychological ramifications as patients struggle with the unpredictability and chronicity of their symptoms. Headaches and migraines represent a complex interplay of neurological and vascular factors. Migraines in particular are not merely severe headaches, but involve a cascade of neurovascular events. They're often accompanied by symptoms such as nausea, sensitivity to light and sound. Tension-type headaches, which are usually characterized by a band-like tightness around the head, also contribute to the overall burden of chronic pain. The underlying mechanisms include abnormal neurotransmitter activity and altered blood flow, which can lead to repeated episodes that disrupt daily functioning. Patients may experience prodromal symptoms, and over time, the frequency and intensity of these episodes can result in significant lifestyle adjustments. Lastly, visceral pain arises from the internal organs and is frequently diffuse and difficult to localize. Conditions such as endometriosis, irritable bowel syndrome, and chronic pancreatitis fall into this category. Pain associated with these conditions often present as deep, squeezing sensation that may be accompanied by other systemic symptoms such as bloating, nausea, or changes in bowel habits. Visceral pain is challenging to diagnose and treat because it does not follow the typical patterns of somatic pain. Rather, it involves a complex network of autonomic nervous system responses and central sensitization. Now that we have explored the different types and structures affected by chronic pain, let's talk about what really matters. How can we manage it? Chronic pain is complex, which is why no single treatment is universally effective. Instead, research and clinical experience have shown that the best approach is multidisciplinary, integrating different strategies to target pain from multiple angles. First, we have medical interventions. These include medications, minimally invasive procedures, and in some cases, surgical options. The goal here is to reduce pain intensity and address the underlying causes when possible. Next, physical therapies play a crucial role. Movement-based interventions such as exercise, manual therapy, and targeted rehabilitation programs help improve mobility, strengthen muscles, and prevent further deterioration. One of the most effective psychological approaches is cognitive behavioral therapy, CBT, which helps reframe negativity throughout patterns that can intensify pain perception. But beyond CBT, we now have strong evidence that mindfulness and meditation can play a significant role in pain management. Mindfulness teaches us to shift our relationship with pain, not ignoring it, but by observing it without resistance. Studies show that regular mindfulness practice can reduce pain intensity, decrease emotional suffering, and even rewire how the brain processes pain. Many people living with chronic pain feel trapped in a cycle of frustration and fear. Mindfulness offers a way to break that cycle. It doesn't take the pain away, but it changes the way we experience it, helping individuals regain a sense of control. Because mindfulness is such a powerful tool, we'll dedicate an entire future to exploring it in depth. How it works, why is it effective, and simple ways to incorporate it to daily life. Finally, lifestyle modifications complete this holistic approach. Simple but powerful. Changes in sleep, nutrition, and daily activities can enhance resilience and improve overall well-being, making pain more manageable in the long run. By combining these strategies, we shift from simply treating symptoms to empowering individuals with the tools they need to regain control over their lives. In the next section, we will bring everything together and highlight the key takeaways from our discussion. In summary, understanding chronic pain through the lens of affected structures, whether it be the lower back, joints, head, or visceral organs, allows us to appreciate both the physical and experiential dimensions of this condition. Recognizing these patterns not only facilitates accurate diagnosis, but also paves the way for more personalized and effective treatment strategies. Before we conclude, I want to take a moment to speak not just as a clinician, but as someone who deeply cares about every person battling chronic pain. I understand that for many of you, this isn't just a clinical condition. It's a part of your daily reality that affects your body, your emotions, and your spirit. Throughout this presentation, we have explored the intricate pathways, the various types, and the specific manifestations of chronic pain. What stands out is that while the science is complex, the human experience of pain is profoundly personal. Every patient journey is unique, filled with challenges, resilience, and hope. I believe that the future of pain management lies in a multidisciplinary approach, one that not only treats the physical symptoms, but also addresses the emotional and psychological aspects of chronic pain. This approach is rooted in compassion, understanding, and commitment to empower you with the knowledge needed to reclaim control of your life. Please remember that you're not alone in this struggle. Advances in research and treatment are continually emerging, offering new avenues for relief and recovery. My hope is that understanding the science behind your pain, you find a renewed sense of hope and clear path towards managing it. Thank you for joining me today. It is my sincere wish that you live here with both the technical insights of pain and the reassurance that chronic pain, while challenging, it's manageable. With empathy, dedication, and the promise of a better tomorrow, remember, pain is real, but so is hope, and together we can make a difference.